Thanks for listening to The Dad Project. To help keep the podcast going, please consider donating at the link in the show notes or on our website, thedadprojectpodcast.org.
Few things are harder than the mission of raising your kids. At The Dad Project, we get experienced dads to reveal what's worked for them, offering practical, time-tested advice. Being a successful dad is tough, and we're here to help you get it done. Welcome to The Dad Project.
Hey there. Welcome to the first Dad Project podcast long-form interview. I'm your host, Josh. We've recently relaunched the podcast and are excited to now offer long-form interviews featuring compelling guests to inspire and inform you, our audience. If you haven't already, please subscribe on YouTube and on your favorite podcast platform. Also, we're a volunteer-run organization, so we rely on donations to sustain our mission. Please visit our website to donate and help partner with us so we can continue to expand our reach and our impact. On this episode, I sit down with Dr. Kheriaty. Aaron's a physician specializing in psychiatry and the author of 5 books, including the forthcoming Making the Cut, How to Heal Modern Medicine. He's a fellow and director of the program in bioethics and American democracy at the Ethics and Public Policy Center in Washington, D.C. Dr. Kheriaty graduated from the University of Notre Dame in philosophy and pre-med, earned his MD from Georgetown University, and completed residency training in psychiatry at University of California, Irvine. For many years, he was a professor there in psychiatry at UCI School of Medicine, and he was the director of the medical ethics program at UCI Health. Aaron and his wife have 5 children. Dr. Kheriaty, welcome. Thank you for joining us.
Good to be with you, Josh.
So for this episode, we want to talk a little about the mental health crisis among the youth in the United States in general and delve into that crisis as it relates to the electronic devices and social media sort of area. So by way of intro, maybe a general assessment of the mental health status of most youth, and then give me some age ranges and, some of the things that are affecting people. And the hope is that for those listening, one, they'll be acutely aware of what's going on out there, right? Knowledge is power in that regard, so that they know what their kids may be up against and the dangers of social media with regard to the mental health crisis, but also not to play doctor at home, but just for them to have an awareness of what is normal behavior for kids and acting out and struggles that parents are going to go through that isn't something that's going to be a clinical issue versus those things where there may be some telltale signs of something a little bit more serious where they're going to need to seek out help from someone like yourself.
Yeah, very good. So I'm glad we're discussing this issue because it's important. And some of the things I'm going to talk about, unfortunately, are not good news. And so I want to be balanced here and walk that line between being overly alarmist and causing parents undue worry or anxiety that, my adolescent is not going to be able to navigate the challenges of the current culture and they're going to have a depressive crisis or crippling anxiety or worse. On the one hand, we don't need to be alarmist, but on the other hand, we do need to be aware because you use the word mental health crisis, and I think that's an accurate word. If you're looking just at numbers, if you're looking just at epidemiology, which is how prevalent are certain problems, certain illnesses or disorders, we do have a mental health crisis that is affecting many Americans, including children and adolescents today. So that is something that parents do need to be aware of. And the crisis is roughly 25 years in the making. And one way into understanding what's going on is just to look at the numbers of the worst mental health outcome that we can imagine, which is suicide. Right? The ending of one's own life is downstream of lots of different mental health problems like depression or severe anxiety disorders or addictions. And that's obviously the outcome that you would want to avoid at all costs. And sad to report, since 1999, so the last quarter century, suicide rates in the United States have gone up among both men and women, boys and girls, in every age category with the exception of the very elderly. So those over the age of 75 have seen a slight drop in suicide rates, but everyone else, including children and adolescents, have seen a rise in suicide rates
Aaron,
over the last 25 years.
For the devil's advocate, can some of that be explained away because we have a better understanding of mental health issues and maybe like a better anthropological understanding of human beings now than we did before? And maybe in our parents' or our grandparents' time, they weren't reporting these things. I mean, they called it shell shock instead of PTSD back in the day, or maybe we weren't properly cataloging or collecting the data. Does that take into account for it, or is that sort of wishful thinking, sort of rose-colored glasses, and not really, squaring things away?
No, it's a great question. And I think for certain mental health conditions, if you see, a rise in the numbers, that might be attributable to just increased awareness, or maybe we're just more sensitive to this diagnosis now and people are coming to clinical attention and they're sort of being recorded as cases. Or maybe even we're over-diagnosing this thing because our diagnostic categories have become too loose, and every impulsive, young boy is going to be diagnosed with ADHD today, whereas a generation or two ago he wasn't. And so when it comes to certain things, you always have to consider that possibility that the baseline numbers or rates of these problems really haven't changed. It's just maybe we're just diagnosing it more than we used to. But with suicide, it's really hard to make that case. And the reason is the suicide numbers don't lie because you have a dead body in the ground. And the ones who diagnose completed suicides or serious suicide attempts are not usually inclined to exaggerate those numbers. If anything, the suicide numbers we have still today are a conservative estimate because there are sometimes ambiguous cases, right? Someone dies of ingesting too much of a medication or overdoses on a drug. Was it accidental or deliberate?
Right.
If the circumstances are unclear, the coroner's probably going to err on the side of saying it was accidental, right? To save the family members the shame or the guilt that's often associated with losing a loved one to suicide. So if anything, our suicide numbers are underreported. 44,000 a year in the United States is a conservative estimate, and basically using the same methods of trying to assess and diagnose a completed suicide that we've used, since these numbers started being recorded 100 years ago. I don't think you can make the case when it comes to completed suicide that our methods of assessing that have changed, or that, we're capturing more cases than we used to. If anything, we're undercounting cases in ambiguous or unclear instances to try to, preserve the family, or, there's even legal issues wrapped up in suicide sometimes. So certain life insurance policies won't be paid out if it was clearly an act of suicide. So I wish I could say that no, the numbers are more or less the same as they were in 1999. It's just that we're catching more of these. But it's pretty clear from lots of different sources of evidence that no, suicide rates have increased in that quarter century. The largest rise in suicide, sad to say, has been among 10 to 14-year-old girls who have seen a tripling of suicide rates since 1999. So this is very serious. And that's part of a larger trend of an increase in so-called deaths of despair. Deaths of despair include suicide, they include drug overdose, and they include alcohol-related illnesses like alcohol poisoning or liver cirrhosis due to chronic alcoholism.
And the 10 or 12
so
or 11
deaths
year old?
Associated with, yeah. So when I was in residency, Josh, which was not that long ago, I graduated from residency in 2007, so less than 2 decades ago. Conventional wisdom and what I learned in residency is that suicide rates you start seeing the phenomenon of suicide, and suicide rates sort of begin spiking at puberty, at adolescence, and that prepubescent children prior to adolescence just don't kill themselves. And that's what I was taught less than 20 years ago when I was trained as a psychiatrist. That, sad to say, is no longer the case. So while it's not as common and not nearly as common as suicide among adolescents or young adults in their 20s or 30s, we are seeing cases now of even 8, 9, 10-year-old children taking their own lives, which is obviously a horrifying and terrible tragedy, and clearly an indication that something has gone wrong in their lives, and perhaps something has gone wrong in the wider culture that's not supporting healthy child development.
How does a 9-year-old or a 10-year-old even have the mental, where does the experiential knowledge in the life of a 9-year-old, how does that develop fast enough to understand what suicide is and to be led to that decision making? It's not a rational, from my perspective, I'm not a doctor, but it doesn't seem like to be a rational way of solving a problem. It certainly is one way to escape whatever trauma or pain that you're suffering through. But so it's not a rational, but it's also a very mature decision in a sense that you're taking into account the final things, which a 9-year-old's really not. They're not getting into the 4 last things in some Thomistic philosophy. As a father of 4 and 4 girls, you mentioned the 10 to 14. I think my girls are pretty mature. They're pretty responsible. We try to make them as responsible as possible, but that doesn't really enter their mind. I don't see how that could enter their sort of mental vocabulary in terms of making a decision. So it's perplexing to me. It's sad, obviously. It's tragic, but it's also perplexing that they would even come to that assessment that this is a viable solution to whatever they're going through.
It's very troubling. And I think the best working hypothesis as to what changed in the last 20 years, where now we're seeing not uncommonly suicide of prepubescent children, is probably exposure to information on the internet. So we've known since the late 1800s in the seminal work of one of the founding fathers of modern sociology, a researcher named Emil Durkheim, published in the 1890s a book called On Suicide. And one of the things that he showed in that book is that suicide, like many other health-related behaviors, positive and negative behaviors, there's a social contagion aspect to suicide. Human beings are built basically to imitate one another. We're mimetic, to use the technical term. We imitate one another's behaviors. We imitate one another's desires, which creates rivalry among people. And that goes for both positive behaviors, like I'm going to quit smoking or I'm going to get clean and sober. If I have a drug or alcohol problem, that can inspire people in positive directions. It also goes for negative behaviors that lead to overeating and obesity and suicide and other things. So one of the things that Durkheim recognized was that when there's a widely publicized case of a suicide, it tends to produce in the days, weeks, or months afterwards, a rash of cases of people using the same means as the person who took their own life. And this is known as the Werther effect. It's based on a classic novel, 18th century novel published by Goethe called The Sorrows of Young Werther. And in this story, the protagonist is a man who's kind of thwarted in his romantic pursuits, and he ends up taking his own life, shoots himself with a pistol. And authorities in Germany and Italy, where this novel was very popular in the years following its publication, noticed there was these copycat cases where young men would die using the same means, and they would have this book tucked under their arm, literally. And so that was anecdotal, but then Durkheim and others in the 20th century replicated this finding in rigorous studies, basically showing widely publicized cases of suicide have this social contagion aspect. Well, the internet allows these things to propagate, right? It allows these examples to propagate. So how does an eight-year-old kid, even if he thinks I'm suffering intolerably and there's no solution to my problem, and this is the only way out, which is typically the mindset of someone who's suicidal. So suicidal people don't necessarily want to die. They want to end their suffering, which they wrongly perceive will never end unless they do this. This is their escape hatch. This is wrongly believed to be the only way out. So that's sort of the mindset. I must escape this. There's no other escape. Therefore, I have to do this. It's not that I'm embracing death as some sort of good to be embraced. It's just, I just want the suffering to stop. But even if, let's say, the 9-year-old kid feels that way, how would he even know how to go about, accessing the means? Well, in the pre-internet age, that would have been much more difficult, right? Journalists used to be more responsible about these things. There are journalistic norms because this Werther effect, this social contagion effect, is well known. There are actually norms of journalistic ethics to not publicize the means used in a suicide. And these are often violated today, by the way, but that there are norms that journalists are supposed to embrace, ethical norms, not to present suicide in a positive light or as a potential solution to life's problems. And I think by and large, those were generally respected in the old days of magazines and newspapers. Now in the Wild West of the internet, they're not respected. And it's very easy to go online and very quickly discover how to take your own life. And, what are the best places to jump from in the local vicinity where I live, the distance that I can ride my bike to if I'm a young person without access to transportation. And there's a lot of people out there online who actually promote suicide, sad to say. So I think part of the answer to your question, probably not the whole answer to your question, but part of it is just the way in which information is now disseminated online, and then the exposure to young people. The young people have to online content that's not going to be conducive to their health and human flourishing. And then the social media and other means of spreading online content, basically facilitating the social contagion aspect of suicide. It sort of amplified something that was already there, but unless the case was publicized in the newspaper or you heard about it, you knew the person personally, you probably weren't going to be impacted by that Werther effect. Whereas now, someone halfway around the world who does this, you could read about them, right, in an online post and have that influence your thinking, or somehow implant the idea of that you should do this or how you might go about doing this if you're thinking about doing it.
Yeah, it seems like the kids' sphere of influence, I'm dating myself too, but I mean, pre-internet all the way through high school, I guess maybe I graduated in 97, so the internet was sort of coming on. You could still try to go to CIA's website and it'd be banners, don't go past this any further, that kind of thing. So, but you didn't know. I mean, you read the news. They had a newspaper that came to the house every day. You watched the news, but it was pretty truncated amount of information, a very small funnel. And now that funnel is just gigantic. And so the sphere of influence for kids in elementary and middle schools is the entire globe, right? So long as they have a device that's connected to the internet, it's always baffled me. We have parts of the world which they don't have clean drinking water, but they have a cell phone with access to the internet and everything.
They got Wi-Fi.
That's on the internet. So it's like, yeah, we can't give you water and clean water to live, but here's some sites on, where the nearest tall building is in your area so you can jump off, it's pretty telling. A quick question. So two-part question. You can tell me which way you want to go. We talk about, obviously you practice medicine in the United States. I'm sure, obviously, you're talking about Durkheim, you're talking about people in Europe. That's sort of a Western culture. I don't know how it works in psychiatry if if you're reading studies from Europe because they're sort of Western culture and it's sort of akin to what we experience. And we've got that sort of connection between the United States and the ancestors from Western Europe. Do we have numbers that compare and contrast either the United States or Western culture versus other cultures with regards to suicide? Yeah. And how does that look just on the whole?
Yeah, that's a great question. The answer is yes, we do. Suicide rates are not rising globally. So while they have been rising in the United States, overall, globally, they have declined somewhat, or in some countries remained steady. And that the trend seems to be there are certain outliers, the United States being one of them. Some other Western European nations have seen problems with suicide. Japan has seen major problems with suicide in recent years. And there's cultural influences in Japan too, shame culture. And, they have a sort of tradition of, with certain experiences of social shame, suicide is presented as kind of a way to deal with that. So there are some unique things to certain cultures that, may also influence their rates of suicide. But one of the reasons that the trend is so concerning in the United States is that it's not happening elsewhere, which should cause us to step back and say, okay, what's going on with American youth that is not necessarily impacting, at least in the same way, other youth around the world? It's not that there aren't other Western countries that are also having problems in this regard, but America almost seems to be an outlier right now in that regard, which, should hopefully cause us to step back and say, okay, hey, what's going on here? And, what are the factors that are contributing to this? And I think there are many. One major factor that, and probably the first one that is worth mentioning, is the problem of loneliness and social isolation. So the Surgeon General in 2018 declared that there was a loneliness epidemic, which may seem like, well, why are the public health authorities paying attention to something like loneliness, which seems to be more of a social or cultural issue or problem?
Yeah, it doesn't sound very clinical.
Health problem. Yeah, it doesn't sound very clinical, but it turns out there's some pretty robust research that the negative impacts of loneliness are comparable to smoking 2 packs of cigarettes a day in terms of bad health outcomes, whether for medical issues like cancer and heart disease, or especially for mental health issues like depression and addictions and the kinds of things that might incline one toward really bad outcomes like self-harm or suicide.
And this is loneliness. This is loneliness that is not, it's not someone who wants to be, like a monk in the desert. Like, I want to be left alone.
Yeah.
I'm not extroverted. I'm really introverted, and I'm sort of peaceful being at home, and it's quiet, and I've got classical music playing, and I'm fine with that.
Great question. Great question. So researchers very often will distinguish between loneliness and solitude. So I just spent 3 days in a silent retreat because I wanted solitude. I have married, I have 5 boys, I have a busy clinical practice.
3 days was
a busy
enough.
life. And, I don't mind other people. They're great. Right. But I'm also kind of introverted and I need my, so I was mostly in solitude for 3 days. Not that I didn't talk to anybody, but, I had a lot of quiet time for meditation, reflection, and so forth. But I was not lonely. I sought that out as a reprieve from the busyness of everyday life. And I still maintained social connections while I was there. Like if I started feeling lonely, I could pick up the phone and call my wife or call my friend or, go and talk to one of the other people that was there making a retreat.
So an important distinction.
Important distinction between loneliness and solitude. So what constitutes loneliness? Loneliness is not having the connections to other people that one craves and one needs to flourish. So 3 days in solitude is generally a good thing for most people. A year in solitary confinement is actually one of the worst tortures you can inflict on a human being, right? Literally, our mind is someone, it's not good for man to be alone. We're hardwired to connect with other people. We're meant to be in relationship with other people. And so too much time spent alone eventually literally leads to psychosis. People start hallucinating. Their mind kind of comes unglued.
Wilson.
It's really bad for your mental health.
Right. Castaway with Tom Hanks, right? With the Wilson.
Exactly. These movies depict exactly what happens after a while, because that deep need to have other people, you find a volleyball and you turn it into, a person and you start talking to it just to avoid going crazy. Right. So
is that like a self-defense mechanism for the mind in order for it to maintain its sanity?
Yet the brain does not function well without connecting to other minds, basically, is kind of the bottom line. And neither does the body. Most of our development and most of our learning and most of our kind of emotional attunement and learning how to navigate the world happens in the context of hopefully secure, what we call secure attachments, secure, trusting relationships with people who are caring for us when we're very young, typically our parents, right? And we know that the lack of those secure attachments psychologically leads to all kinds of problems later in life, emotionally, psychologically, mental health. So we're not built to be alone. And so this problem of loneliness, back in the 1980s, generation or two ago, if you polled Americans and asked them the question, do you have someone in your life with whom you can discuss important matters? You were to develop one survey question to try to assess loneliness. That's a pretty good proxy. You have someone in your life, family member, a friend, a colleague at work, with whom you can discuss important matters. You're going through something difficult. Do you have someone to talk to about it? 20% of people in the 1980s said, no, I don't have anyone like that in my life. 1 in 5 people, which is sad.
Yeah, that's very sad.
Today, that number is 40%. It's doubled. 4 in 10 people say, I have no one in my life with whom I can discuss important matters, right? And we all suffer. We all run into difficulties. To be able to navigate and contend with that is much easier when I have a tight social network.
Yeah.
So the idea of loneliness too is, do you have people that are available when you need them? It's not that you need them all the time. It's not that you need to be hanging out with people or talking to people all the time. But when you need them, are they there? Right. And the fact that 40% of Americans say, I don't actually have that, that's setting us up for, very serious problems, including, as it turns out, including health problems, medical health problems and mental health problems.
I guess from my perspective, I'm very fortunate to have a loving wife and family and friends and a very good, social network. And I think that's why it's so hard for me to believe that, right? Because obviously, I don't know, my experience is that we as human beings project a lot, right? So I would never do something, so I can't see how this other person would do this thing, right? Or I think this way, so like mint chocolate chip ice cream is the best ice cream there is. How can you not like that? It's your favorite, right? So we're always sort of projecting, right? Our frame of reference is really ourselves in a lot of ways. So it's sort of a projection on my part, right? It's hard for me to believe that 4 out of 10 Americans don't have someone that they can just pick up the phone or text or meet at work or in their neighborhood. So that's just, it's extremely sad. Ugh. So,
well, I mean, they may have acquaintances, they may have Facebook friends, but
real friends.
Facebook friends are not friends, right? And so this is another aspect of the social media phenomenon, is that we know that the health benefits, if you will, of relationships are based on in-person, face-to-face, real relationships. My parents live in another state, so I call them on the phone and we talk on the phone, and that's a great way to connect. Right. We might do a Zoom call or FaceTime. That's a great way to connect. I'm not denigrating those means of connecting, but if those are the only ways in which you are connecting with certain people, those connections are simply not the same. They're not as strong.
Yeah, they can't replace
They're not as meaningful. They're not as beneficial.
Yeah.
They cannot replace what happens when you interact in person. And so we had this loneliness epidemic in 2018. We had this rise of deaths of despair in 2018. 2 researchers from Princeton, Case and Deaton, Nobel Prize winning researchers from Princeton, published their book on deaths of despair prior to the COVID pandemic. And then,
this is prior. I forgot about that. So
this is prior to COVID, right?
Wow.
So let me just tell you what happened with I won't say with the COVID crisis, but rather with our response to the crisis, because I think the way we responded was not necessarily the way we should have responded. But with lockdowns, with school closures, with social distancing, we poured gasoline on that fire. We were so focused on preventing the spread of this virus through any means necessary that we forgot about the downstream knock-on health consequences of the things that we had put in place, right, to try to deal with it. Things that turned out to be fairly ineffective anyway at stopping the spread of the virus. But the lockdowns, the school closures, the social distancing, the masking of faces, which also impaired our ability to connect with people when we were with them physically, all this threw gasoline on the fire. So going back to those deaths of despair numbers, I mentioned drug overdoses. These numbers are staggering, Josh. It's really, really sobering when I talk about this. In 1999, there were 20,000 deaths by drug overdose in the United States, which is tragedy. By 2018, that number was 70,000. And, we were talking about the opioid crisis and people were starting to pay attention to it. Then in 2020, with our response to COVID, we poured gasoline on that fire and that 70,000 number jumped to 100,000. So a quarter century ago, we had 20,000 deaths by drug overdose. Today, we have 100,000 deaths a year by drug overdose. Same thing happened to alcohol-related illnesses during the pandemic. Went from 69,000 to 99,000. So 30% increase, more than 30% increase in drug and alcohol-related deaths. So we took a problem that was already a serious problem and we poured gasoline on that fire. So that's all by way of the bad news, right? And this bad news, unfortunately, is impacting adolescents and young adults, and even trickling down to children, as we mentioned earlier in the podcast. So it's just something for us to be aware of. Rates of depression, which are harder to ascertain for the reasons we talked about earlier. Maybe it's being overdiagnosed in some cases. Maybe we're just more sensitive to it in other cases. Mental health issues have, to some extent, been destigmatized among young people, which is a good thing. But, right. Maybe they're self-diagnosing or overdiagnosing a little too much. Based on, what their friends are saying or
having a bad week, having a bad semester, all of a sudden I'm clinically depressed and I need something.
But even for all that, we do have what I think is some pretty good epidemiological evidence that rates of depression have legitimately gone up. Not just the diagnoses of depression, but the actual clinical manifestations of depression. And that would be consistent with everything else that we've talked about, right? Because most suicide is associated with some significant level of clinical depression. So if we're seeing a lot more death by suicide or suicide attempts among young people, it would stand to reason that maybe rising rates of depression among young people are contributing to that.
Hey, thanks for listening to The Dad Project. If this talk was valuable to you, please go to our website at thedadprojectpodcast.org and make a voluntary one-time or recurring donation, or use the link in the show description below to help support our operations. Any amount helps. Catch you next time at The Dad Project.